Major Depression by Layla Hall, S00138-381. What is major depression? It sounds like a simple question, but it's actually quite hard to answer because health professionals tend to define the entity of depression based on a certain criteria, which has changed over time. Currently, depression is defined as a persistent state of low mood associated with a loss of interest, meaning that usual pleasurable activities that would normally be enjoyed aren't experienced in the same way. Many health professionals will say to be diagnosed with major depression, you would have to experience this criterion with a combination of numerous varying symptoms for a minimum of 2 weeks, which consequently impacts on and interferes with the person's day-to-day life. What are the signs and symptoms of depression? Depression is a complex disease that varies from person to person, but there are some common signs and symptoms. It is unlikely you'll have all the symptoms, but it is common to have a mixed combination. Symptoms can be categorized as psychological, social, and physical. Psychological symptoms refer to a person's feelings and thoughts. A sufferer may face many adverse feelings, including unhappiness, being overwhelmed or highly irritable, sad, or have zero confidence. It is also common that an individual experience harmful thoughts about oneself, like I'm a failure, to more extreme destructive thoughts. These more extreme thoughts act as a catalyst for other symptoms and even suicide. Social symptoms are to do with a person's behavior. An individual may start to withdraw socially by not partaking in usual social activities or events, or neglecting hobbies and interests. Social symptoms are also associated with the use or misuse of drugs and alcohol, which can be used as a coping mechanism. An important symptom in this category for detecting depression is when people say they are unable to concentrate and have a lack of motivation. Physical symptoms. A person experiencing depression doesn't only suffer adverse psychological conditions, they can also affect a person physically. Health professionals view physical symptoms as the second core criteria to low mood and loss of enjoyment. Fatigue, poor sleep, change in appetite, or weight are considered the next criterion of symptoms which occur as a direct result of depression. So, what causes depression? Well, this is the hardest question of all to answer because the exact cause of depression is still unknown. Depression is not just a result of a chemical imbalance in the brain, and it's simply not cured with medication. Depression is caused by a combination of biological, psychological, and social factors. However, certain risk factors make you more vulnerable to depression. A person can develop depression for different reasons, and it has many different triggers. Additionally, depression does not result from a single event, but from a combination of events and other long-term or personal factors. So far, why people develop depression in a medical point of view is still unknown. However, what we do know is that certain trends can cause certain populations to be more at risk. Essentially, we're all at risk for developing a depressive illness. People of all ages, races, and social class can become clinically depressed. No one is completely immune. However, it is important to know that major depression tends to affect some populations more than others. Research suggests that social environmental factors like socioeconomic status, employment status, relationship, past and present physical and mental health, where you live, social networking, diet, sleep, and physical activity can all trigger depression. So depression can run in families, and some people will be at an increased genetic risk. This does not mean that a person will automatically experience depression if a parent or a close relative has depression. Life circumstances and other personal factors are still likely to have an important influence. Personality. Some people may be more at risk of depression because of their personality, particularly if they have a tendency to worry a lot, have low self esteem, are perfectionists, are sensitive to personal criticism, or are self critical. Serious medical illness. Additionally, having a medical illness can trigger depression in two ways. Serious illnesses can bring about depression directly, or can contribute to depression through associated stress and worry, especially if it involves long-term management of the illness and or chronic pain. Drug and alcohol use. Drug and alcohol use can both lead to and result from depression. Many people with depression also have drug and alcohol problems. Over 500,000 Australians will experience depression and a substance use disorder at the same time at some point in their lives. How common is depression? The lifetime prevalence of depression in women is approximately 20% compared to that of men, which is at 10%. For reasons that are not entirely known, women are twice as likely to develop depression globally. There are several theories as to why fewer men than women are diagnosed and treated for depression. One, women may be more inclined to seek help compared to men. Men may be less willing to acknowledge and talk to someone about their emotional symptoms. Men may mask their depression through the use or misuse of drugs and alcohol rather than seeking professional assistance. Women may tend to be under more stress than men. They have many responsibilities and full schedules at home and work. And women may be more prone to depression because of the possible side effects of hormones. Women have frequent changes in their hormone levels, which women can become vulnerable to depression due to the hormonal shift. So, how many people seek help? You would assume everyone, but this is not the case for various reasons. Access and availability plays a major part in why people don't seek help. For example, people may live in rural or isolated areas, which make it difficult to access professional help. Furthermore, facilities that cater to this disease are few and far between in rural districts and even more in the developing world. Awareness in some regions, like the developing world or in particular cultures, is still vague, which may result in an individual not seeking help. Depression is still not widely known or even accepted by members of certain communities. Trust is an important element for an individual to seek help. Many factors come under this umbrella of trust, like does a person trust their doctor and healthcare system? Do they trust in the information they have received or heard, or does that individual trust himself or herself? But most importantly of all, stigma is the greatest obstacle to seeking help. In addition to their symptoms, people with depression have to cope with stigmatizing attitudes, either their own or from other people, which can have several adverse side effects, including delay in seeking help, difficulties with personal relationships, and potentially could further provoke psychological symptoms for that individual. How is depression treated? There is a range of effective treatments and different health professionals who can help people on the road to recovery. There are many things that people with depression can do for themselves to help them recover and stay well. The important thing is finding the right treatment and the right professional for the individual's needs. Effective treatment for depression often includes some form of